Our ultimate goal is to make sure that children and families heal, recover, and thrive. And our trauma therapy program is a critical part of what we do. Lakeshore Children's Advocacy Center is one of 40 children's advocacy centers in the state of Michigan. Our role is to support child abuse investigations, to provide access to critical services for child survivors of abuse and their families, and to raise community awareness about child abuse and neglect in our communities, and to help support prevention efforts. A vital part of our program is trauma therapy. We have 3 contract therapists who provide trauma therapy, play therapy, individual therapy, family counseling to make sure that we are walking with this family on the road to recovery. We have therapists every day meeting with kids in age-appropriate, evidence-based practices to help them process what has happened to them, so that they can move beyond the abuse, so that this becomes part of their story, but not the defining factor. Our CAC has seen a steady increase in client numbers and in needs for therapy services. We reached out to Blue Cross Blue Shield of Michigan and their Community Health Matching Grant to help meet this lapse between what we were able to provide and what our community needs. Blue Cross Blue Shield has supported our therapy program with a 2-year grant that is going to allow us to provide 600 sessions over 2 years that may not have been able to been covered otherwise. Every day, we see children making progress as a result of working with our therapists. We see them coming in perhaps fearful, overwhelmed, really working to make sense of what has happened, not only the child, but the family too, because the trauma of abuse affects the entire family. And we have the great privilege of watching these kids do the hard work of making sense of this and working with our therapy team in order to take steps forward. Without support from organizations like Blue Cross Blue Shield, we wouldn't be able to make as deep and lasting impact as we are able to. Research has shown that there are better long-term outcomes for children and families when they have the support of a qualified mental health counselor who's specifically trained in trauma counseling, and being able to provide that help to the kids and families who come to our center each day is an honor.